Welcome to a new program, a new day, a new episode. Today we will talk about the Somaliland medicine industry, especially the pharmaceutical. There was a recently interview with the Sadiq Samatar with MMTV and have been really trending so long. Sadiq Samatar, welcome to Maha.
Thank you very much for having me.
It's great to have you. This program will be a little bit special. Last program you did it was in Somali, and today we're doing English to understand the deep and the problem of the pharmaceutical industry in Somaliland. So we're really pleasure to have you.
Thank you very much.
Tell us who you are.
Okay, so my name's Sadiq Samata. I'm a pharmacist, registered pharmacist in the UK. I've worked in the UK for over 13 years, and I've worked in Somaliland for nearly 2 years.
What was the impact for the program you did with MMTV?
To be honest, there was a huge positive feedback in general about the I call it more of a awareness campaign. It was more of an awareness campaign to show people what's happening in the pharmaceutical industry.
I mean, some people was writing the comment, you come in a whistleblower. Is that really what you think?
Sort of, yes. Whistleblower in the sense that to just put a spotlight on the problem. Yeah.
Okay, so if we look around really the depth and the issue,
Yes.
what is the biggest problem for Somaliland pharmaceutical industry?
And the main problem is the quality of medicine and also falsified medicines. So if I can try and sort of give you a definition, and falsified medicines are medicines that are claiming to be from somewhere, or are either lying about where they're from, or they're lying about the content in them. And the second part is the quality of medicine, which the WHO calls substandard medicine. Substandard medicine are medicines that are low in quality. So I think that is very important for your spectators to understand a bit more.
So we talk about fake medicine.
Yes.
If we put it in a black and white terminology.
Yes.
So when we talk about the fake medicine, what
Yes.
is the biggest problem Somaliland fake medicine has?
And to be honest, it's not just Somaliland; it's all over Africa. But I think it's more acute in Somaliland due to no legislation or enforcement. So based on the work we have done for the last 2 years of trying to understand how bad falsified and substandard medicines are, we have come to the conclusion of it being up to 50% of medicines in Somaliland are either substandard, poor quality, or falsified medicine.
So what's that mean?
That means 50% of medicines are, when you take them, they don't work as needed, or they would not. They could cause harm and not treat the actual disease.
So 50%, if we put a blame, 50% of the medicine come to Somaliland from everywhere in the corner in the world.
Yes.
Are fake.
Not fake. I would say poor quality and falsified.
Falsified.
So fake does come under that umbrella.
Okay. Sadiq, do you have any scenario case for that when you're doing the research for the last 2 years?
It wasn't research, it was more like inspection. So part of our inspection, part of our job, in my previous job, was to go out.
So you was working to get this information. You was working Somaliland
Quality Control.
Quality Control
Commission.
Am I right? Yeah.
Yes.
So what did you come out with it?
So there, what we had to do was we had to go out into different wholesalers, importers, and try and see what stock they have, what conditions, if there's any falsified medications, if there's any poor quality medications. So in general, what we will do is we'll go into a place, we'll pick up samples, and then we'll send it off to the lab in Berbera or lab in Kenya to sort of analyze. So a lot of times what we will see is the medicine would come out to be poor quality, or in some cases fake, as you say it. And to be honest, there hasn't been a huge scale research done to say for a fact it's 50%, but it's an estimate. There was a study, large-scale study done in Ethiopia, which is the neighboring country, and there has come up to be 25% of medicines were either substandard or fake. But if you compare the weakness of governance in Somaliland and Ethiopia, you can tell Somaliland has a weaker governance system. So from there we have extrapolated, and we came to the conclusion of an estimation of 50%.
Right. So who bring these medicines?
To be honest, it's not well controlled. So everyone and anybody brings medications here, and you could be a butcher and tomorrow decide to import a medication. You could be larger companies, like well-known companies nowadays in the market. They also bring in medication. So it's literally free for all.
So going back in the Western world, or the South of Africa, to be a medical or pharmaceutical company, you have to have a license, right?
Yes. Bear in mind, in the pharmaceutical market is the most regulated market in the world. But in Somaliland, it's the opposite. It's actually the least regulated market in Somaliland. So you can see the disparity between the lack of regulation.
All right. So that is the one case. I just want to share with the audience. Is there any storyline of people who took the medicine?
Yes.
Who have been really affecting it?
And we had instances. For example, we had a lady that came into our office one day, and she was complaining about her epilepsy tablets. So epilepsy is a lifelong condition, and the medication she bought from the pharmacy, she was saying that it wasn't working and it wasn't controlling her epilepsy. And upon inspection, physical inspection, we looked at it, and it was quite hard medication. It was very hard to break. So we decided to send it off to the lab to sort of analyze it and see what's the issue with the medication. It came out to be substandard, which means it was the medication was authentic, but I think there was some sort of reaction that must have happened while it was being transported, and it became really hard and impossible to break. So if it doesn't break or it doesn't melt in the required time, then that means it will not work as needed. So that was one instance. And we had a few other instances with pharmacies, not necessarily the pharmaceutical product, but the pharmacies that are causing problems for the general patient. We have another example of a girl that also takes epilepsy medications. She went into a pharmacy with a prescription, and they gave her the wrong medication. And mainly it's because the person that was selling her medication wasn't a pharmacist, so they just guessed, or they guessed like which medication could it be, and they gave it to her, and she did say she was hospitalized because of that. So you can see from there's a huge problem with the supply chain.
Sadiq, a little bit sad to hear that. Can you elaborate more? Go me through when it comes to medicine to Somaliland, and where does it come from most of the time?
Okay, it's best for you and your spectators to understand the whole supply chain first of all, to understand where the issues are. We'll start with procuring the medicine from abroad. A lot of times what happens is the people that are procuring medicines, they procure from maybe I would say a dodgy pharmaceutical manufacturer. As you know, in India there's over 5,000 pharmaceutical manufacturers, so there's literally manufacturers everywhere you go in India. And sometimes what happens is they would procure it from a dodgy or not so great manufacturer. That's one aspect. And then the second issue is they would import it in transportation in the wrong way, because if you look at most medications, at the back it says do not exceed over 25 degrees. They would import it in a dry container. What's a dry container? It's a container that doesn't have any temperature coolant, and it will be in the sea for nearly 2 months, and it could go through like fluctuations of temperatures up to 50 degrees, especially if it's going through Middle Eastern countries. So you can see that there could be a damage, there's a risk of damage into these medications in that transportation. And then the third part is when it comes to the Somaliland ports, there's no proper facility built by the government to store pharmaceutical products that are imported in Berbera port. So you will see pharmaceutical products that are literally out on the tarmac. Tarmac, not even warehouse, tarmac. And even some boxes would clearly say, put it away from sunlight. But it's because of the staff that are in a port that are not well trained to look after the pharmaceutical products, because pharmaceutical products are very sensitive in nature. And then the fourth part is once it comes to major cities like Hargeisa, they have warehouses that are not suitable to store pharmaceutical products because there's no air conditioning. In summer months it could go really high, and even the building, the way it's built, it's quite sealed, so you can have like huge trapping of temperature in there. And then there's the fifth part of things, which is pharmacy. When they sell to pharmacies, are pharmacies storing them? Retail pharmacies I'm talking about, by the way, not the wholesale. Retail pharmacies, are they storing in the correct way? And then there's the sixth part, which is the person that's working in the pharmacy. Are they a pharmacist? Do they know about medication? Do they know how to sell the right medication? And that could have a huge issue, which was the same example I was telling you about the lady that had been given the wrong medication. And then there's the seventh and the last one, is the doctor prescribing the right medication? Because a lot of times there's a diagnosis problem, not necessarily the quality of medication. So it's a whole chain that's connected. If something is wrong in one place, the whole quality of medication is gone.
So you make me scared because I live here, and so did my family and everybody. I care. If the chain is really gone wrong, it's really sad. What will be the solution now?
That is mainly for the government. So what can the government do? They can increase legislation. They can increase training for staff, especially at Somaliland Quality Control Commission or even the Ministry of Health, so that they can enforce these rules. And they can increase training for people that are importing medications. They can restrict the amount of people that have the license to import medication, so they know who's importing what. They can start registering medications so they can keep an eye on what's happening. And the public can also take part as well. So if you're part of the public and you've taken a medication and you became sick, especially a medication that you've been taking for a long period of time, then you can report it to the government and say, hey, this is what happened, so that they can track. And then the last part, which is very, very important for the government to do, is to invest heavily in their labs, because that's where everything becomes clear. If they can invest in the lab, then they can test more products, and if they test more products, they can stop a lot of fake medications.
Right. What will the people can do? I mean, the society. What will the society can do? I mean, as we have the obligation to do something. What will the society can do?
To be honest, it's very limited for them, and there's basic things they can keep an eye on. Like I said, if they get severe side effects from a medication that they've already been taking before, or basic things like having a look at the outside of a medication to see if there's any tampering, if the expiry date is different, basic things. But to be honest, it's only the government that can bring back the confidence of people and the only way they can do that is they start giving out strict licenses, and then the people can only buy from those licensed pharmacies only, and not the black market.
There must be the businessmen who's bringing this stuff.
Yes.
They are part of the society.
Yes.
What can they do? I mean, this is illegal. This is haram in a way, in Islamic way. When you bring in a fake medicine,
Yes.
I'm not a sheikh, so do you. But we can see 1 + 1 is 2.
Yeah.
So what will a businessman can do to stop to harm for the innocent people who are taking the wrong medicines?
And businesses, to be honest, larger businesses tend to try their best. It's the smaller businesses that are the biggest culprit, in my opinion, from what I've seen on the field. But also larger businesses can help the government by reporting if they see anything another business is doing, anything wrong, because they're also very interconnected businesses. So, for example, if you're a businessman today in pharmaceuticals and you run out of medication, they tend to buy it from each other. You know, they collaborate. So if you can see another colleague is doing something dodgy, then by all means you have to report it to the government, so that the government can crack down on anybody that's doing something wrong. So they can help. So everybody can take part in their role, to be honest.
Sadat Samatar, thank you very much for coming, really, and it's really a pleasure to explain us what's happening in the pharmaceutical company.
Yeah.
To this next program, hopefully we're going to see you, Mahar. So please share and like the page, and we'll hopefully see you more.